There's this fantasy about getting pregnant is this wonderful ethereal moment where you're floating around barefoot, with flowers in your hair, enjoying your enormous belly. Actually, the reality is your body can hurt. You can feel pretty worried.
Welcome to this episode of the Bump in the Road podcast. Bump in the Road is brought to you by Derbyshire Family Health Service, part of Derbyshire Community Services NHS Foundation Trust. Today, Dr. Claire Scothern, a clinical psychologist, talks about the challenges that many people face during their pregnancies and some things that you can do to help yourself during this time in your life. Please be warned that this podcast may cover topics that are sensitive for you. If you feel like you need support, our contact details are listed at the end.
So we want to talk a bit, don't we, about the realities of pregnancy and the realities of adjusting to this enormous change that parents go through, that mums go through, which is getting pregnant, sustaining a pregnancy, being pregnant. And I guess we just want to think about how many myths there are around this, how many fantasies there are around how pregnancy and motherhood should be versus the reality of what we know as humans, and we also know as health professionals can be the case for women. So staying well through that period is crucial because it's actually a really vulnerable time, and a time where, again, we know evidence-wise that a lot of women do struggle with mental health issues through this period, even if they haven't had mental health issues before. So stress and adjusting to motherhood and struggling is pretty common. Hence, it's important that we start talking more openly and realistically about pregnancy, I think. So thinking of, whether someone has had a baby before, whether this is their first baby, whether there've been losses before or fertility issues around getting pregnant. I think there are some real common themes for all of those people. And that is that it can just be a real minefield. Your body is changing, your hormones are flooding your entire body. So making, having more estrogen knocking around, say, having more progesterone, which means you'll be starting to feel very emotional. So there's a real a normalcy around having these big ups and downs and worries around, am I going to be able to do this? Am I going to be a good mom? Is this going to go well? Thinking of people that have had losses, am I going to be able to, maintain this pregnancy? Is my body working with me? And then there's the relationship changes that come through pregnancy. So on a very basic level, trying to maintain friendships, trying to maintain sort of sanity in the workplace if you're a working person, as well as how society then starts to treat you a bit differently when you're pregnant. People can be seen as vulnerable. People can be seen as something very unsexy, if I can say, about being pregnant, and that can really start to make you question yourself as a person, as a woman. It can make you think about yourself and your identity quite differently. So all of this is to say, there's this fantasy about getting pregnant is this wonderful ethereal moment where you're floating around barefoot, with flowers in your hair, enjoying your enormous belly. Where we know actually the reality is your body can hurt, you can feel pretty worried, and your mood can be up and down. You can be resentful towards your partner for not carrying a baby. So there's all kinds of things that we are aware of, and maybe we're not talking about them as much as we could be talking about them. there's also, I guess, social media comes in here, doesn't it? With how celebrities present their pregnancies and how people on, influencers, etc., present their pregnancies, gender reveals, and all of these aspects that can make us feel that we're less than, that we're not doing a good enough job if we're not enjoying this period, that we are somehow flawed if we're too big or we're too small, or we're not having a gender reveal. So yeah, I guess all of these, well, as I'm speaking about it, I just think the adjustment to being a mom, being a parent, is probably harder than it's ever been because of the lens that's now put on this period of time. From a psychological point of view, I think there's lots of things that people can do in order to take care of themselves through this time. So just thinking on a basic level about social media, being really mindful about how much time you spend on there, but also thinking about who do you follow, what accounts are you following, seeking out some accounts that are a bit more positive. Perhaps if you have had pregnancy losses or you are struggling with identity, there's places like Tommy's that are really good too, or sites, accounts like Tommy's that are good to follow, where people share their pregnancy journeys in a bit more of a realistic and balanced way. But yeah, being mindful about how much you want to communicate to on social media about your circumstances, and not feeling that you have to overshare if you don't want to. Maybe trying to seek out some accounts that are more supportive. Just having a little browse around to find things that mean something to you can be really probably quite restorative and encouraging. I guess as far as basics, keeping an eye on your mental health is important through this time. People will ask you how you feel through this time, and I guess I would encourage open conversations. So find someone that you trust to tell if you are struggling, and find someone to trust to talk to, fellow mums, people that have been through it, say people that you feel safe with, to tell them how you're feeling, because often we hold things inside thinking there's something wrong with us, that we shouldn't be having these strange thoughts about ourselves or these resentful thoughts about being pregnant. But actually you might find that other people are having the same thoughts, and that in itself can help you to feel a bit better. There's kind of key principles that psychologically, again, I would recommend that anybody sort of lean on to take care of themselves through any period of time, but particularly through pregnancy. I think it's dead important to connect with other people, because there's a lot of evidence that if you do join pregnancy groups or try and find people you can have a slightly deeper connection with, who are in the same boat, that can really, really help when your babies are born. Then you can continue to share the challenges and the joys together. That can be hugely beneficial mental health wise. Staying active, this is something that has always been quite controversial, isn't it? This idea of oh, you need to rest, oh, you need to protect your body, and oh, should you be at the gym if you've got a baby? But I think we've moved on an awful lot now. We know that it's actually really important to keep your body physically active through pregnancy, particularly if you're someone that's always kept their body active. Links between exercise and good mental health are really clear now. There's no need to stop your activity in pregnancy. Keep it up, but just listen to your body. You might need to adapt what you do. But again, if you are someone that uses exercise for stress management usually, then this is really important. And it's always going to stand you in good stead when it does come to giving birth. Keeping learning, keeping your brain active, keeping yourself engaged with things that are nothing to do with pregnancy, and having babies is important too. So that whole idea of your identity doesn't have to completely change just because you are pregnant. Keep in touch with your other friends, keep in touch with, again, if you're a working person, keep on putting yourself forward for new projects at work. You don't have to stop and wind everything down, although it is a nice opportunity to do that. But, keeping your interests up outside of pregnancy will be a really good way of balancing your mental health as well, so that you're not just fully immersed in this other world. Mindfulness, I guess mindfulness is a really simple concept of stay in the present moment. So just keep your attention focused on the here and now. And that's a brilliant tool at any time in life. But again, with pregnancy, you might be really worried about things much more than usual. You'll be more tuned into aches and pains, more tuned into body movements, baby movements rather. So any opportunity you can take to just remind yourself that you're safe, that you're grounded, keeping your feet on the floor, putting your hand on your chest and just, closing your eyes, telling yourself that you're safe. That is a super helpful strategy if you're feeling overwhelmed. Sitting and having scans, having people prodding and poking and measuring can be really anxiety provoking. So anything you can do, in those waiting rooms, to just look around the waiting room, notice the colours on the walls, notice the other people in the room. If we focus our mind on one thing, it stops it bouncing around to worry and bouncing back to, past experiences that might have stressed us out. And a final thing that can be really good to scaffold you is giving to other people. So actually, we know through research and so on that taking the time to be kind towards someone else, or giving something without condition, is really good for our mental health. So these are all kind of basic things that you can just kind of lean on through pregnancy. They're not wild ideas. It's not having therapy. It's not needing to do anything more intense, but it's just staying connected, getting connected with other people, keeping your brain active outside of pregnancy stuff, being physically active, having those little acts of kindness, and staying mindful. So those kind of 5 essential ways to well-being for all of us don't have to go away through pregnancy.
If you're struggling with your well-being during pregnancy or with your baby and you feel like you need some support, you can contact Derbyshire Family Health Service on 01246 515100 and make an appointment with a health visitor. You can also text us on 07507 327769. This is a confidential text messaging service for parents-to-be and parents and carers of 0 to 5-year-olds, providing advice and support from one of our healthcare professionals from Monday to Friday, 9 a.m. to 4:30 p.m, excluding bank holidays. You can also visit our website at derbyshirefamilyhealthservice.nhs.uk.